What is the role of neurotransmitters in urination? Imagine your bladder as a smart, adaptable storage tank that knows exactly when to hold or releases urine. The secret behind this smooth control lies in tiny chemical messengers called neurotransmitters. These molecules act like messengers, carrying signals between your brain, spinal cord, and the muscles in your bladder. They help coordinate the complex process of urination, making sure it happens at the right time and in the right way. When your bladder fills with urine, sensory nerves in the bladder will detect this stretching. They send signals to your brain and spinal cord, alerting you that it's time to go. In response, your nervous system releases specific neurotransmitters that tell your bladder muscles to contract or relax, depending on whether you need to hold or releases urine. One of the main neurotransmitters involved is acetylcholine. It is released by parasympathetic nerves and binds to receptors on the bladder's smooth muscle, called the detrusor muscle. When acetylcholine attaches to these receptors, it causes the muscle to contract, which initiates urination. This is why medications that block acetylcholine activity are sometimes used to treat overactive bladder symptoms. Another important neurotransmitter is adenosine triphosphate, or ATP. It is often released alongside acetylcholine and can also stimulate bladder contraction, especially in certain health conditions. This helps fine-tune the bladder's response to filling and emptying. On the other side, the sympathetic nervous system releases noradrenaline, which promotes urine storage. Noradrenaline binds to beta-3 adrenergic receptors on the detrusor muscle, causing it to relax and allowing the bladder to fill comfortably. It also acts on alpha-1 adrenergic receptors in the internal urethral sphincter, causing this muscle to tighten and prevent leakage. This dual action helps keep urine in until you are ready to go. Sensory nerves from the bladder while also releases neurotransmitters that send signals about how full the bladder is. These signals travel to your brainstem, specifically to a region called the pontine micturition center. This center processes the information and decides whether it's time to urinate or hold it. It then adjusts neurotransmitter releases accordingly, coordinating the switch between storage and voiding. This entire process is a delicate balance. Neurotransmitters enable your bladder to relax when filling and contract when emptying, ensuring urination is voluntary and controlled. Disruptions in these signaling pathways can lead to problems like overactive bladder, urinary retention, or incontinence. Some bladder conditions, including bladder cancer, may affect nerve function or neurotransmitter activity, which can influence bladder control and requiring careful medical management. Understanding how neurotransmitters work in urination helps us appreciate the intricate neural control behind bladder health. It also highlights why maintaining proper nerve function is vital for bladder function and overall well-being. If you experience bladder issues, consulting a healthcare professional can help identify whether nerve signaling might be involved and guide appropriate treatment. Remember, each person's nervous system is unique, and medical advice should always be personalized to your specific situation.